Hello, I'm Ken Lloyd from Ken Lloyd Denture Clinic at 91 Ebley Street, Bondi Junction. These are just a few of the things I do with regards to construction of dentures. I do everything myself. I'm self-employed. This is a full lower denture. Just like a demo model, I've put some colour through the acrylic to make it look more natural. Now this one has what's called a soft base. See how it bounces? It's a German product. It never goes hard, just gives relief to a full lower denture so it doesn't have a hard base. Like I say, it's very durable, never goes hard. I usually put a metal bar through the full lower denture just to give it some strength, but because this one's quite thick, it doesn't require a bar. Just put some colour through the acrylic. I don't know if you can see it, just to make it look more natural. The teeth are called Wiederpan. They're a German tooth with a Wiederpan back tooth, posterior tooth. So I'll just place that back on the model. Now this one is a bit of a prototype denture I made up. The patient was having implants, so this is a copy of what I made for the patient. As you see, again, I put some colour through the acrylic just to make it look more natural. Now this is more like, I guess I'd call this a bit of a hybrid denture. It's the two-part. So I've just taken the pink hard acrylic base away from the denture. But here we have a soft base. There's no wires on the denture. I just take off this section. It's flexible. So it's quite comfortable. It was for the patient. As I say, this is a copy of what I made for the patient. Now this just clips back onto the denture, this soft base, and then I put this in back and it's sitting on there perfectly and looks good. No spaces. Again, the teeth are a Wiederpan tooth to match the colour of the patient's natural teeth. You can see I put some colour, I think you'll see it, some colour through the acrylic. Just makes it look more natural, like a normal gum colour. Okay, now this is a full lower denture. Now if you can see it, there's a line. See the line through the middle of the denture on the inside. Like the denture before with the soft base on the bottom, on the base of it. This one is easy to maintain because the soft base is through where you see that line. That's the soft base. I'll put it through the middle of a denture. It's a lot easier to maintain, to keep clean. Obviously because it's in the middle of a denture. It's encased in the denture. You see the line comes through on both sides. Yeah, so it's a soft base that I've incorporated into the denture, but through the middle of the denture. Okay, so I'll just pop that back on the model. That's that one done. Now this is just an alloy frame to be ready to support a denture if a patient's lost these 4 back teeth on the left hand side and 2 molars on the right hand side. Now on the front section, the 4 posts are to accommodate the 4 missing front teeth. So the posts are there to support the 4 teeth when I put them onto the denture. The posts give the tooth the strength. So what I do is I cut a hole in each tooth, and each tooth will fit over the post, the metal post. And of course, when the tooth is on here, you won't see the post, but it gives the tooth a lot more strength. So the finished denture is quite rigid, and it's a beautiful, what we call a plate design, which fits perfectly. It just comes removable from the front. It's just the frame, the alloy frame. I can reduce the clips in beautifully. I can reduce one of these clasps, but the patient wasn't worried, so I'll leave both the clasps there, and it just gives it a bit more retention. Just a perfect fit. Now this is just a full upper and lower that I've constructed on the articulator. Okay, this is how it should perform. Over teeth, again, they're a German tooth. I put a little bit of colour through the acrylic again, just to make it look more natural. And there's some, so you can see from the palette, I wax the palette up in a particular way to replicate the rouge. The palette is, the dentures are fully constructed in pink acrylic. It's called Diamond D. It's the best acrylic on the market. However, sometimes when I'm making a denture, I cut out this palatal section of a denture and pack it in a clear. So when the patient smiles, you can't see the pink. It's just a clear acrylic. It's exactly the same fit, just a different colour. So yeah, that's what I do. But these teeth again are a good quality. They're a good quality German tooth, and that's how they articulate. Looks quite natural. On this lower denture, there's no soft base. It's just you can hear the difference. It's just a normal acrylic denture. They're fitting perfectly. Yeah, so that's it. Oh no, I have one more just to show. Sometimes when I don't, this is a part upper alloy frame denture, which is a metal and alloy. The backings here, I put backings on these teeth because sometimes when there's not enough room for the teeth, depending on the bite of the lower teeth, we construct the frame with a little alloy backing behind the tooth. It gives the tooth a lot more strength, so the tooth can't pop off when it comes into contact with, say, the lower tooth in this condition. Yeah, so it's a teeth a little dark to match the patient's colour of the tooth. Yeah, so it's a part upper denture with, we call these alloy backings. It just keeps the denture a lot stronger. Yep. Okay, so that's just some information on the things I do. One other little thing here, you can see the difference. This is a part upper denture. See the colour through the acrylic on this side. One side has what's called tinting, and the other side it's just plain pink. I think you can see the difference. I like to put colour through the acrylic because it just looks a lot more, sorry, I'm just reaching for the light. It just looks a lot more natural with the colour through the acrylic rather than plain pink. Okay, any inquiries, just let me know. As I say, it's on my shirt, Ken Lloyd Denture Clinic, and I'm at Bondi Junction, Sydney, Australia. Thanks for your time. Thank you.